Welcome to this edition of Research Connection. Joining me today is Dr. Kate Bailey and Dr. Erin Keenihan. Thank you for joining me.
Thanks for having us.
Thanks for having us.
So tell us a little bit about yourselves.
So I am a clinical anesthesiologist who did vet school training here at NC State, went into a private practice internship, came back for my residency at NC State, and then stayed on as faculty. So I've been here for a while. My typical research interests have to do with what I call the underrepresented species. So things that people don't tend to study a lot, things like fish and frogs and turtles, so mostly aquatic-based species. So this is a little bit new for me, but we're hoping that this research might actually help us later with some of those species.
I did vet school in Western Australia and was in private practice for 8 or 9 years before I did my residency in radiology in London, and then moved here and I'm a tenure track radiologist. I'm mainly interested in advanced MRI techniques, so it ties in with the research that we're doing, looking at some of the more advanced sequences to better quantify what's going on with the central nervous system.
Neat. And you two just teamed up on a grant.
Correct.
Yeah, so we were lucky to receive a Morris Animal Foundation pilot grant, and we probably should shout out to Dr. Gianluca Bini, who was a big component to getting that grant done and submitted and approved, which is exciting. So I can speak to the anesthesia side at least of what our goals are with that grant, and basically what we want to look at is the effects of certain drugs on cerebral vessel tone, cerebral vessel reactivity, and that becomes important in patients that might have brain pathology, basically. So brain tumors and things like this, often we need to image those patients, and then often we need to surgically, correct some of those things. And the drugs that we pick can affect cerebral vessel tone, etc., which can basically affect morbidity and mortality in those patients. And we wanted to look at that, and it turns out functional MRI and some of the interesting scans that we're going to be able to do can really help us sort some of that out.
So we're going to try and look to see if there is an appreciable difference between two standard anesthetic drugs that we use and one that's relatively new to the market, to see if we can demonstrate which is best for those purposes. So a lot of the studies that have been done looking at this have been terminal studies in the past because we haven't had these advanced imaging techniques. So we're going to use two techniques, one called BOLD, which looks basically at the amount of oxygenated blood that's being delivered to an area of the brain, and as the brain is activated, more of that oxygenated blood gets delivered to that area, so it picks up those differences. And another technique that hasn't been used in dogs before called ASL, or arterial spin labeling, so that looks at perfusion, relative perfusion of different areas of the brain, to see if we can pick up a difference between the drugs.
Right, so based on the fact that oxygen delivery and utilization is really important for those patients, well, for all patients, but specifically for those patients with, brain disease, that will be a really useful piece of information clinically.
Neat. And is it a specific kind of animal, or?
Well, we're doing it dogs,
yeah,
but the hope is that we can translate these into other species, so aquatics would be lovely.
Yeah, so kind of as a separate, potential future project that we would also involve others in would be looking at some of these aquatic species that can be really difficult to assess for things like pain and consciousness, that we might be able to use these techniques to better understand them as well.
People have probably seen BOLD used. It's in the news recently with the conscious dogs being scanned in the MRI and looking at recognition of their owners versus non-known humans and rewards. So we're using that sequence just in anesthetized dogs using different parameters.
That's neat.
Yeah, it's cool.
Sounds like good work.
Yeah, we're really excited about it.
We're excited.
Thanks for sharing.
Work out.
Thanks for having us.
Yeah.
Thank you.
Best of luck.
Thanks.